I think the pilot performed slightly worse. There was no participants indicated that they do this often, um, or nearly all of the time. So we have these mean scores. Again, we drill down on the evaluation aspect, on the evaluation gear. So we asked about evaluation methods specifically, and whether or not those methods are robust and rigorous in being able to capture the right data and assess those outputs. We asked about evaluation agility and frequency. That received a 2.29. So evaluation methods, there's just a significant opportunity there. It scored the lowest, so that's something we might want to look into for this sample size. Let's go to the third one. So using evaluation findings to change practice. 2.57 has scored the highest, but still 57% of people said we do this sometimes. There's opportunity for improvement across the board here in this sample size, in this with these participants, right? Scope of evaluation, whether or not we are evaluating against the quadruple aim with an equity lens, and whether we're measuring all of these dimensions that we want to improve on. That's what that fourth bar is getting at. And again, engaging partners for evaluation. So there's opportunity for improvement across the board here with this sample. I want to iterate that this is meant to be an to illustrate how these findings are could be presented, right, with this tool that we are iterating and developing. So this provides you with an illustration for how we could do this for EuroHT if we were to we use this tool and assess capabilities against the framework. In the tool, if you recall, when I presented the tool, we allow for people to provide open-ended comments. So we provide that opportunity so that people can provide statements and comments. And so for each one of the gears, we collect, valuable statements that highlight some opportunities and strengths, which we can then translate into potential action plans that, as a team, we can then prioritize afterwards. So for example, for the analytics gear, participants highlighted inadequate staffing and high turnover. So for example, for work that impacts my area, inadequate staffing and lack of succession planning has been one of the many barriers for researchers requesting data for scientific investigation. So that's a people-related problem with analytics. And so some of the actions we could investigate is we could pursue our are exploring what the root causes of that high turnover could be. Maybe develop a succession plan and resources to facilitate new hires or training materials. So that could be an area of focus so that we can ensure that continuous ability to use data and collect data and mitigate that high turnover, for example. And so other things that people commented on were lack of resources for qualitative data analysis, and not just not just opportunities or weaknesses or negative or even barriers, but people also commented on successes and strengths. And so for the evidence synthesis, one participant highlighted that they had a robust approach and process for developing guidelines and recommendations, with expert panel step and including patients with lived experience. And so that might be something that we might want to disseminate. And so that best practice could be disseminated across. This was a large organization. And so disseminating those best practices that have been developed in specific programs and areas could be a good strategy to enhance performance and breaking silos, right? So disseminating those best practices. And then for the co-design, the last year we heard there was an opportunity to engage with diverse with patients, families, and caregivers. And that could be an opportunity here for us to pilot test and figure out how to do these things, how to co-design with patients, and then disseminate best practices. So a lot of the issues can be addressed by action, right? How do we if we're not doing so well with co-designing with patients, let's figure out different ways of doing this, and then learn from our co-design efforts.